Fluid balance is the concept of human hemostasis, that the amount of the fluid lost from the body is equal to the amount of the fluid taken in. The humans can survive for 4 to 6 weeks without food, but for only a few days without water. The amount of the water varies with the individuals, as it depends on the conditions of the subject, the amount of the physical exercise, and on the environmental temperature and humidity. The water constitutes 60% of total body weight. The body's water is distributed in between the two compartments. This is extracellular fluid and intracellular fluid. The fluid found within the cell is called as intracellular fluid. That is found outside the cell is called extracellular fluid. The extracellular fluid is further divided into that which is found as a blood plasma within the blood vessels, and that which is found in the microscopic spaces between the cells is called intercellular fluid. Approximately 2/3 of the body fluid is intracellular fluid and 1/3 is extracellular fluid. Of the extracellular fluid, approximately 80% of interstitial fluid and 20% is blood plasma. A selectively permeable membrane separates body fluids into distinct compartments. The plasma membrane of the individual cells separates intracellular fluid, extracellular fluid, and blood vessel walls separates blood plasma from the interstitial fluid. The major components of this fluid includes water and solute. The solute is mostly comprises of electrolytes, the inorganic compounds that dissociates into ions. Electrolyte includes cations and anions. Cations are positively charged atoms. Examples are sodium, potassium, calcium, magnesium. The anions are negatively charged atoms, and examples are chloride, sulfate, phosphates, bicarbonate, and carbonate. The exchange of interstitial and intracellular fluid is controlled mainly by the presence of electrolytes, sodium and potassium. The potassium is the chief intracellular cations and sodium the chief extracellular cations. The body fluid distribution in the various compartments. The body water is maintained at a constant volume by regulating between the intake and outtake of water as given as shown in the figure. Regulation of fluid balance. The term fluid balance defines the state where the body's requires amount of the water is presence and a proportionate normal amount the various compartments. Under normal condition, water loss equals water gain and body's water volume remains constant. The water loss takes place through the kidney, skin, lungs, feces, and menstruation. The gain water mostly from the dietary intake. This is called as a performed water. The metabolic process such as cellular respiration and dehydration synthesis reactions generate in a small component. Water is not produced by the body to maintain hemostasis. The metabolic water production is simple a byproduct of cellular respiration. The body regulates water intake via the thirst flex, which stimulates us to drink. When water loss is greater than water gain, the body reaches a state of dehydration, and dehydration stimulates the thirst reflex in three ways. Saliva level drops, resulting in a dry mucosa in the mouth and pharynx. Increase in blood osmotic pressure, which stimulates the osmoreceptor in the hypothalamus. There is a drop in blood volume, which leads to the renin angiotensin 2 pathway, stimulating the thirst center in the hypothalamus. Mechanism: thirst center. The intake of water is regulated by the thirst center situated in the brain. When there is a decrease in body fluid volume, it leads to increase in the salt concentration, and hence there is increase in osmolality and increase in the osmotic pressure. The external extracellular fluid. As a result, the intracellular water comes out and the cells become dehydrated. The dehydration of the cell stimulates the first thirst center, which sends messages to tongue and throat, causing the dryness and drink more water. Drinking inhibits the thirst center by stretching the stomach and intestine and reduces the osmotic pressure of the blood. Antidiuretic hormones, ADH. ADH helps in reabsorption of water from the renal tubules, and thereby loss of water from the body is regulated. It is a hormone secreted by the posterior pituitary. When there is a decrease in body fluid, osmotic pressure of extracellular fluid increases, which stimulates the cell of hypothalamus, which in turn stimulates the posterior pituitary to secrete antidiuretic hormone. The ADH, the antidiuretic hormone acts on the kidney tubules and increases the reabsorption of water, thus converting water. When the body fluid content is sufficient, the osmotic pressure of extracellular fluid is normal or low. During this condition, there is no stimulation of hypothalamic cells or posterior pituitary, so antidiuretic hormone is not secreted. fluid. As a result, there is a decrease in the reabsorption of water from the renal tubules and more water is lost in the urine. Dehydration. Hypovolemia, loss of water from the body in excess amount leads to the dehydration. First, the plasma becomes concentrated, followed by the extracellular fluid and then the intracellular fluid. When water comes out of the cell, it passes into the extracellular fluid in exchange of potassium and sodium, passes into the intracellular fluid and extracellular fluid. Loss of more than 20% of body water results in death. Causes of dehydration: severe diarrhea and vomiting, excessive heat, difficult in swallowing and state of unconsciousness, loss of fluid from the skin in case of burns, diabetes insipidus, heart stroke, excitement, fever, excessive sweating. Dehydration induces water to move from the reservoir inside the cell into the body. If dehydration progresses, the body tissue begin to dry out and the cell starts to shrivel and malfunctions. The most susceptible cell to dehydrate are the brain cells. Mental confusions, one of the most common signs of severe dehydration may result and can lead to coma. The dehydration can occur when excessive water is lost with such disease as diabetic mellitus, diabetes insipidus, and Addison's disease. Dehydration is often accompanied by deficiency of electrolytes, sodium and potassium in particular. Water does not move as rapidly from the reservoir inside the cell into the blood when electrolyte concentrations decrease. The blood pressure can decline due to the lower volume of water circulating in the bloodstream. A drop in the blood pressure can cause a lightheadedness or feeling of impending blackout, especially upon standing. The continued fluid and electrolyte imbalance may further reduce blood pressure, causing the shock and damage to many internal organs, including brain, kidney, and liver. Feature of dehydration: dryness of skin, tongue, and throat, changes in the value of packed cell volume, HB, plasma protein, plasma electrolytes, urea, and decreased blood pressure. Treatment: consuming plenty of water or water containing sugar and salt depends upon the cases of dehydration. If the condition is very severe, the intravenous infusion of the fluid, normal saline, is required. Water excess, hypervolemia. It is the condition in which the body water content is excess, causes hypersecretion of antidiuretic hormone following administration of anesthesia. This effect occurs for about 12 to 36 hours after surgery. Renal failure, SIADH syndrome. Here hypersecretion of ADH occurs. Causes of SIADH: some malignant conditions, diseases of the central nervous system, and side effect of certain drugs. Overhydration can occur alone or in conjunction with the excess blood volume. Distinguishing between the two conditions may quite complicated. The overhydration induces water accumulation within the and around the cell, but does not typically show symptoms of fluid accumulation. On the other hand, with the excess body volume, there is an accumulation of sodium and the body cannot transfer water into the reservoir within the cells. The conditions such as heart failure, liver cirrhosis may induce volume overload, whereby the fluid accumulates around the cell in abdomen, chest, and lower legs. Feature: